Cloud. Good morning. Hi, Belinda. How are you doing?
Good. Good morning.
I'd like to welcome Belinda Gunning, Executive Director of Behavioral Health Alternatives in Wood River, Illinois. We will be discussing the healthcare policy at the local level this morning, and she's agreed to answer some of my questions so we can talk so that she can present some of her ideas how she manages her operation to the students of my healthcare policy course at Lincoln Memorial University. So good morning, Belinda. Again.
Good morning.
Yeah. Tell us about behavioral health alternatives. How long has it been around, and how long have you been involved as staff, and then as executive director?
Okay. Behavioral Health Alternatives has been around for 39 years. In July of 2024, we will be celebrating our 40-year anniversary. I have been with the company for 31 and a half years. So started out as a crisis counselor, then moved into quality management manager, and then to program manager, and then executive director.
So you've been there a long time.
Long time.
Yes, our careers are completely different. So I'll jump right into it because I think the big problem that local agencies face is finances. So how is your agency typically financed?
As far as for our mental health services, we're fee for service. The state moved away from mainly a grant funded source many, many years ago. So we contract with the state with their managed care providers. So we provide a service and they pay us for that service.
In more recent news, hopefully that's going away. How did COVID affect your finances with things like state funds, federal funds, and the tax credit?
Well, obviously during COVID, services were down, so income was down as we're fee for service. But the year following, the state provided what they call a sustainability grant. So they figured out what your typical billing amount was, and then you were eligible for that amount of funding from the state then that following year. So that was beneficial to help us get through. Obviously, unfortunately, I feel like we're still feeling the impact of COVID. A lot of people still do not want to come in for services. You know, they like everything by video or a phone call, which is difficult when providing mental health services.
Okay. I know that you had applied for some of the assistance that had been offered at state and federal level, and some of that was disappointing.
There were grants available this past 6 months, I'd say, which was a capital improvement grant, but it was for like security things, life essential repairs, capital grant. So that was good to see, but unfortunately, we didn't fall into that category of needing those things. It was for like security, fencing, just like life and safety. So unfortunately, you know, everyone's heard how mental health has been underfunded for the past, and I'm going to say, you know, 31 and a half years that I've worked it. So we're needing things like painting, carpet, you know, furniture, and those things are things that are not covered and not, you know, you can't write a grant for. People don't want to cover those costs. Yeah. So, I mean, but the good news is that funding has increased. The bad news is that it'll take a while for us to benefit from that.
Right. Yeah, okay. Interesting how they, it's kind of uneven. What policy and related changes, such as the pay of employees, have been affected by the administration of Illinois Governor Pritzker?
So not too much pay directly. Last year we had to update our policy on bereavement leave, it expanded who was eligible and the circumstances for which you could take bereavement leave. Now, then there's a new policy coming up in January where all part-time people are eligible for paid time off. So then we'll have to update our policy on that, which for us, for policies to be approved, they have to be given to the board a couple weeks in advance of a meeting for them to review and approve. So we're actually in the process of updating that paid time off policy. So
That
it's,
sort of help.
obviously everyone deserves some time off, but when you're a fee for service company, now I'm paying someone to be off and then also not receiving any money during that time off. So I think overall it's a good policy.
Right. I think I may have skipped over clarifying that you're a not-for-profit. Because you
Yes,
say,
right.
sorry,
Yep.
just to clarify, yeah, and then you have a local board, and
Yes. And
that's
so, and also probably might want to mention is that we're totally Medicaid. So that's all people who are in poverty and eligible for the state Medicaid program.
right. And your service region, what is your region?
Madison County, Illinois.
That's about, what are they, around a half a million people there, or I can't remember.
Maybe more of a 250,000.
Oh,
It's one of the
yeah,
bigger counties, and honestly, I should know that, but I for some reason I'm thinking a quarter, but it could be more.
and you used to have both BHA, I recall, used to have both part of St. did some work for St. Clair also, and when there was a hotline.
Yeah,
So yeah, and for my students, that those are counties in Metro East St. Louis. So they're in Illinois, but they're the main suburban counties that surround St. Louis in Illinois. So that you know the geography if you want to look that up. May have covered this a little bit. So are there bills in the legislature surrounding mental health improvement? Maybe some more capital improvement bills in Illinois or in the legislature or anything
I'm not
happening in
aware
that?
of anything coming up as far as capital improvement. Now, they have eased some of the regulations on video and phone services that we're able to provide. So during the pandemic, we were still able to serve people. Previously in the past, most codes required a face-to-face visit for billing. So once COVID hit, they kind of eased that up. It seems like those options are still going to be available. The problem that we run into is that we have the ability to use the web apps and things, but our clients do not. So
Right.
it's nice that we can if they're able, but the majority of them either do not have reliable internet, don't have a good phone. So
Oh, right. With telehealth, I
yeah,
meant to mention to you about telehealth. So that is, yeah, that's where your main area you're looking to expand into, but there are limitations, I guess.
there are barriers.
Yes. So even in a metropolitan region like this, you would think it'd be more of a rural challenge, but still a challenge in an area like the St. Louis metropolitan area. Um, that kind of leads into what do you see as the most daunting challenges for your agency within the current policy climate or climate in general?
I think that the policies are changing to make it easier for people to access mental health. Really, the challenge is, I think, still the stigma of coming in for mental health and how it'll impact their employment and stuff. Because we have lots of people call and schedule appointments, but I used to say if we scheduled 4 assessments, 50% 2 would show up, and then of those 2, 1 would follow through. And here in the last couple of years, it seems that has declined. You might schedule 4, 1 will show up, and then they may or may not follow through. So I think more people are eligible for Medicaid, they're working, and I think it's just the stigma of either, needing to ask off or, being seen walking into a mental health agency.
Mhm. Right, right. I think it might be helpful, just getting back to your career for a second, to tell us about, how you got involved, what your background is education wise, and what's required to become an executive director of a mental health center like yours.
Yeah, so I was required to have at least a master's degree and licensed in my field. So I am a licensed clinical social worker.
Right. And with a master's.
That's
You
a
began,
bachelor's, master's, and to receive a license, you obviously get your master's and then you're supervised for 2 years before you can take your um, licensing test.
excellent. I
Then you're
see.
required 30 continuing education units every 2 years to maintain that license.
Ah, yeah. And all right, that's very interesting. I think that's good information for my students. I want to thank you for taking the time to talk with me and to share your knowledge of operating a local mental health facility. And I hope this is beneficial to them. And I thank you again. I'm going to
Sure. My pleasure.